Hello, my name is Gary Church. My company is Bay Area Health Solutions, where my website is bayareahealthinsurance.com. And today I want to kind of address an issue and a concern that I have with a lot of young people, particularly young families. You're working, you have your family and so on. And through your working efforts, what do we take for granted? We take oneself for granted of what we have. I say a life-changing event, even for a young person, a life-changing event can destroy a whole family emotionally, physically, and financially. One of the things I really want to target and help you understand is if you're working for a company that provides health insurance, that's fine. You're getting coverage through your employer, and hopefully it's covering your family, and you understand what your responsibility is. But as our healthcare system changes, employers are more and more passing on the cost, because the biggest cost for employers is health insurance. So what we're going to start to see is an increase in co-payments and deductibles. So the question comes down to, as a young person, if you had a life-changing event, something happened, you had an accident or something that put you in the hospital, but you're a family of four, that you depend on your income and your health insurance, and you don't have the proper protection, what's going to happen? I always say that there's four things we want to cover. One, the most important asset you have is your ability to earn an income, whether it's you or your spouse. If one of you were to lose their job due to an illness or an accident, what happens to that income? You're able to pay your bills because you have two incomes coming in. But what if one of those incomes goes away? Well, there is a solution to be able to protect your income, and that's through income protection, using disability insurance to help supplement your lost income due to an illness or an accident. That's the first part. The other thing is, what do you have for your health insurance? Do you understand your deductibles? Do you understand what your max out-of-pocket's going to be? Again, as I alluded to earlier, if you got a medical bill and that bill's $10,000, or your child gets injured and they're in the emergency room, what are your concerns? It's about the well-being of your child. But what's the after effect of that treatment? Is your child being treated and released? And what's the bill that you're going to be paying? What's your financial responsibility for paying that? Do you have the financial means to pay for it? Can you take the money out of your checking account to pay that medical bill? How much is your employer going to cover? They're only covering their portion, which is the health insurance itself. So what are you going to do? So having the appropriate coverage, which I refer to as gap insurance, that's going to be able to cover those co-payments and the deductibles and the medical bills. So there are solutions, and that's what my responsibility for my clients is, to be able to help you be able to understand what these benefits are. Health insurance is a necessity. It's a necessity. Gap insurance, whether it's a critical illness, hospital indemnity, or even an accident policy, and even life insurance, is a benefit. Why? Because if something did happen to you or to a family member, do you have the financial means to continue on? Because once you're gone, you're gone. So having a comprehensive health plan in place outside of what your employer offers is key. It's as if you're investing your money in your 401k. What's the purpose of your 401k? To build towards your retirement, so you have money when you retire, when you want to retire in your part. The problem is it guaranteed? No. But gap insurance it's a benefit. Why? Because it provides money directly to you when you have a life-changing event. So the four key areas I want to cover is: one is your income protection. Two is making sure that the health plan you have is a comprehensive plan. Three is building on a gap policy. And four is life insurance. Life insurance is important, particularly for young families. Do you have the right coverage? Has anybody really sat down and understand your situation? My responsibility to you and all the clients I work with is making sure that what you have in place is your plan that's going to protect you financially. Whatever investments you have or your investments. But what you want to do is you want to protect the investments you have, and that's through having gap coverage. I'd like to be able to take the time to be able to sit down with you, be able to go over all the options so that you can understand what your options are. So again, if you'll visit my website, which is www.bayareahealthinsurance.com, on the home page on the bottom right, you'll see a link that goes to my calendar to schedule a time that works best for you. Whether you just have questions, not sure about it, please feel free to reach out to me. Because our healthcare system is changing, and not only is it going to affect individuals and families, but it's also going to affect employers. So you as an employer that's offering health insurance, you can admit that your biggest cost is healthcare. It's whether or not you can get through and be able to provide those benefits to your employees that have a real benefit to them. I'm here also to work with you as an employer to be able to help your employees navigate and protect them, because I know that you as an employer want to make sure that your employees are taken care of if they have a life-changing event. If you have a valued employee and he can't come back to work for some reason due to an illness or an accident, I think you have the compassion making sure that that employee is okay. I have solutions that will help you to protect your employees. So with that said, visit my website. I'm here to be able to help you navigate through and understand what the options you have and what you want to be able to provide to your employees. And again, for individual and families, I'm here to help. And I want to thank you very much for taking the time to listen to me.